Hey, my name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Chandler, Arizona. Thank you for tuning into my podcast. Today we're going to continue with the concept of how trauma impacts our endocrine system. Before we start, would you mind just please tagging right below there and subscribing, and then we'll get on our way. So we've done several episodes on, trauma and how hormones are affected by trauma. And I want every one of these episodes to be a standalone. There's one that's 2 parts. All right, I'll take that. But I would like it to be as much standalone as it can, so that way you get a snippet of information just with these videos. This one is going to be very specific to the adrenals and to cortisol and to the impact that has on your experience of trauma and how trauma can become PTSD or post-traumatic stress disorder, where trauma then lasts longer and it becomes something that's a part of your life, unwanted part of your life over time, and how cortisol plays a role with that. And then how cortisol would play a role in the treatment before, during, and after having a traumatic event. 1, to prevent the traumatic event from being pushed into PTSD. 2, to help resolve PTSD symptoms with cortisol optimization. And then 3, to reduce the inflammation that comes secondary to people who have PTSD. A lot of material I want to cover today. So hopefully I'll be able to do it in one episode. Before I do, one other thing I want to say, if you look at the past couple episodes, you'll notice I had little, I think it was on this side, on this side. So I cut myself shaving. I know I'm 55 years old, and I cut myself shaving. So I cut myself shaving, and I put a little ointment on it to hopefully stop it from bleeding. But I didn't realize the ointment was still on there. So if you see that little part of my face there that was a little shiny, that was ointment. That was me trying to stop the bleeding. That was it. And I realized I do these videos, and I'm not really the most put together person. I don't really do all the makeup. Like, people do that. Guys do that. Guys who do podcasts, I think, they do makeup, right? Do they? They probably do. They do makeup. They have like face stuff. They go people in it. Like, I've seen videos of myself where it's like, what did I do? Did I shave that day? Or like, I've had episodes be kind of like run down a little bit. So I want you to know I'm going to be better at not being distracted by having shiny stuff on my face, and do my job a little bit better at being prepared for this. I want you to know that part is not important to me. People come online and it's all about image, and they want to look a certain way, and they'll filter it up, and that's life. I know that. It's part of it. Part of how we need to present ourselves. True. But don't you know that's not where I am. I'm also not here and trying to show you that I'm smart. I really don't want to do that either, because this is not about me. This is doing these sorts of things can be a real trap for your ego, and can trap your ego, and you start thinking it's about you as the presenter, and you want to look good, you want these things, you want these presentations, you want people to think you're this or that. It's all about trying to feed in me an ego. And I want you to know that is something that I am not here for. I love my work so profoundly, and I feel so lucky to do what I do. And in truth, it's awesome. And some of you who've watched these videos, who've seen the reels, have worked in this kind of setting with a care provider, or you are a care provider, and you know what I'm talking about. This can have a profound impact on someone. And then when it's done well and right, it's just how medicine's supposed to be. So it's rewarding to the physician to be able to do work that has meaning, and is rewarding to the physician to be able to apply themselves, I believe, to apply themselves and all of their capacities, all their abilities, to apply that to help their fellow person who's in the room, who's in need. So that's why I'm here. And that's why I forgot I had ointment on my face. And I just made that video. And that's why sometimes you see my hair is kind of like cockeyed. And, I don't come in here being like, how can I be pretty in the moment? That's really the last thing. As long as my glasses are clear, my lenses are clear, and I'm articulate, and I'm present, we're good. So let me get into the cortisol and the adrenals. When we talk about the adrenal gland, there's a lot of material on the internet about the adrenals. And if you were around in the 1990s watching cable TV at night, you would see all these Cortislim and Corticut all these things talk about cortisol causes belly fat, and they have those videos. You remember those videos? I don't know if we could pull a video in there, Justin, like the Corti Slim or Corti Cut, where they show the person cortisol makes your belly fat.
Well, diet failure is not your fault. The problem is cortisol, a nasty little stress hormone that traps excess fat around the middle. But now there's Relacor. Relacor helps control cortisol and helps us lose stubborn belly fat fast. If you're dieting and still plagued by unsightly belly bulge, even if you're low-carb dieting, there's only one Relacor.
And I've done videos explaining how that's not quite correct. It plays a role, but it's not quite correct. What I'm trying to say here is that we've understood cortisol as being a function of stress for a very long time. And it's been in the public domain for a very long time. And people commonly know this now. And if you haven't, now you know. But still, many people have seen this in advertising. And we also know that people who have had chronic stress tend to have a cortisol issue that must be somehow or another, it is somehow or another associated with belly fat. And that's all we know. And the way marketing has been done is to just say, high cortisol causes you to gain weight. And that's what we understand cortisol is now. That's just how people think of it. So when I'm in the clinic with my patients and I say, I'm seeing an issue with your adrenal gland and we need to treat your cortisol, that touches the third rail for a lot of people. It triggers a lot of people because they don't want to take a medication that causes them to gain weight. So picture me in the room with someone who has PTSD, someone who has anxiety, someone who has depression, someone who has mental, emotional stress in their lives. And I'm trying to address it. And then meanwhile, I'm saying, hey, by the way, we're going to do this cortisol because it's important. It sometimes can push them too far. And so that's why this is such an important topic. And that's why I've done videos on it in the past. We've done episodes in the past. We're doing another one now. This is more specific to trauma. Let me start off by giving you a primer on what cortisol does in your body and why you have it. Cortisol is a part of it. It creates a circadian rhythm. It's elevated in the morning, and as day goes by, it drops down, you fall asleep. So it starts up a little bit higher when you wake up, and it drops down. And that's just the normal rhythm of life. Cortisol, when it is right, and it's going through that rhythm in your body, it's a natural anti-inflammatory. That's good. It modulates your immune system, as I mentioned in the last episode. Totally important. It also plays a role with the basal metabolic rate. It does improve metabolism. This is a weird thing for you to hear, but bear with me. This is important. And I've used this analogy before because I think it works. Remember when you're younger, if not you, just maybe you think of a friend, when they had a severe stressor, like say you're in high school, they break up with their significant other, and it's, traumatic, it's a big deal. And then they'll lose 5-10 pounds. The thing is that 5-10 pounds of weight loss, that was cortisol. Cortisol in and of itself causes you to burn weight. It causes you to lose weight by itself. This is a truth. This is a scientific truth. This is not arguable. This is a fact. Cortisol in and of itself does that. Now, over time and excessive exposure to cortisol, excessive stress occurring in your body, your adrenal gland, by secreting so much cortisol at high levels, stimulates your pancreas to stimulate more insulin than you're supposed to have. So now you have high cortisol, which causes that weight loss we're talking about. That's up there, but now your insulin's starting to creep up. So your fasting insulin, the higher that fasting insulin goes, the more difficult it is to burn fat as an energy source. And at some point, it's going to eclipse your cortisol's ability to help burn weight. And that's what happens to us when we've been under chronic stress over time. So the adrenal gland plays a role in preventing inflammation, modulating the immune system through the inflammation pathways I mentioned, increasing that basal metabolic rate. It kind of wakes you up in the morning. It does a lot of things for you. And the other one, as I mentioned, it does play a role with healthy weight metabolism when it's in the zone it's supposed to be in. So cortisol is important. Say you're in your mid-20s and you're working. So you're my classic female patient. You mid-20s, you're working at a job. And again, I'm dating myself a little bit here because I know things have changed, but there's still a lot of this happening. So if you're not experiencing this in your life, I'm so happy. If you've been experiencing this, you've experienced it throughout your life, this is something you'll identify with. You'll work at a job where you're not paid the same as your peers, male peers. You work at a job where you're not acknowledged to the same degree that your male peers are. You're working, longer hours, more hard to get the same advancements. That's a stressful thing to go through. And you're working in this job and having this out of stress. Or say, you're married and you have children, you're home monitoring children, taking care of children, but you're doing it all by yourself. You have a significant other, they're working, but there's a lot of stress. Now, if you have that stress going on and on over and over again without respite, and you're working at this job or you're having this home life, these things are very stressful over time. If you don't take care of yourself, your adrenal gland, because it's been being elevated initially from acute stress, over time, because of the stress over and over again, it's going to start diminishing your cortisol output. So your cortisol output becomes less and less over time. It becomes lower. That's what adrenal fatigue is. That's what burnout is. So say you're in a stressful environment and you stay in that stressful environment, and the environment that's stressful stays that way, and you don't leave it, and you don't take care of yourself, you don't have downtime, there's no recovery, anything that's beneficial in there. You don't have a dog like this to reduce your stress. Do you know I'm talking about stress? Is that why you're doing this? So what burnout is when your adrenals are not keeping up and your cortisol levels are lower. And that's just a fact. Now, say you're in your 20s and you're under fatigue from that burnout and a traumatic event occurs to you. Something bad happens. It could be assault. It could be an accident. It could be trauma of any kind. And when that occurs and you're into that environment, you have a traumatic event happens to you, with low cortisol, your chances of going on to have post-traumatic stress disorder is higher. As I mentioned in a previous episode, when people have traumatic events, that doesn't always mean you're going to have PTSD. Sometimes we'll have a traumatic event and we get through it and we're fine. It doesn't create PTSD, but some people it does. And that has to do with the way cortisol plays a role with consolidating memories and the way your body structures memories. Cortisol plays a role in that. Other hormones do as well. And we can talk about how progesterone and allopregnanolone and estrogen all play a role with memory consolidation and the role that plays in PTSD. And that is an important topic to discuss. But I really want to discuss what happens with someone who's been under chronic stress just from day-to-day burnout, and they have a traumatic event, how it flips into PTSD more easily, more readily. So we know it does that. So in those people who've been traumatized, have low cortisol, they have a higher rate factor for developing developing PTSD, post-traumatic stress disorder. In a way you think about this tracks, doesn't it? Think about it. Like, if you've had like a stressful life and you have a big event happen, it's like you're just already down. It's like kicking someone when they're down. Where I want to go with this is like there's studies, and this one specifically that's going to be going up on the screen now. This is a study done on women who've experienced sexual assault, and their cortisol levels during the emergency room visit, and the varying levels of cortisol they had, and what that meant for their development of PTSD later. What the study shows, what's really important, and this is just one of many, that shows that when you have low cortisol, suboptimal levels of cortisol, showing that you're in that state of burnout or adrenal fatigue or adrenal insufficiency, and you have a traumatic event occurring to you, such as this study shows, your chances of developing PTSD are much higher, much higher. Now you're thinking like, Brendan, these videos are supposed to be educational. How can I apply that information, Brendan? Does that mean that I should be on cortisol now if I'm under stress? Should I be treating my adrenals now? Yes, that's one. I will just say this. Those of you who are watching this who don't have PTSD or don't have a history of trauma, I would just say this. Managing your adrenals are incredibly important. Managing the stress in your life, managing burnout in your life is incredibly important and should never be overlooked. There's plenty of episodes I've done on it. There's plenty of other people who've spoken on this. Managing stress is incredibly important long-term, because if you get hit with something when you're in a state of burnout, it doesn't go well. It rarely goes well. So we know that people who present to the emergency room after a traumatic event, this study, but many others also of different types of traumatic events, have a higher chance of PTSD based upon their cortisol levels when they came in the ER. That's one. Two, the next thing that becomes important then is that, do we treat them in the emergency room with cortisol? Does that help them by giving them a therapeutic dose of hydrocortisone? Now, there are many studies that show that it does, but if you're in a hospital, that's not going to happen. I mean, rarely do they do that. I mean, no, actually never. They never do that. Let's just call it what it is. That's not going to happen. So right now, hopefully, in time, based on the research that's being published, they will start to do that because that will help prevent you from developing PTSD. Think about that. Those of you who have PTSD, those of you who have suffered a trauma, imagine that when you went to the emergency room or to your doctor right around the time of the trauma and they treated you immediately, that it would have prevented you from developing PTSD or at least mitigated the risks significantly. Even minor mitigation, even reducing a little bit would be beneficial, I believe. So that studies are there. That's real. That's valid. That's important. So in the moment with someone experiencing trauma, getting that cortisol online helps. What about down the road? Once you've had that traumatic event occur and you've had that consolidation of memory, you've created this pathway and you've developed PTSD, say that's what we're discussing here today. And what do we do in those people? What's happening with them? When someone has post-traumatic stress disorder, the only therapy I know that I've ever seen working, and it's not because I have a closed mind. I mean, cognitive behavioral therapy, I'm open to that working. I just haven't had really strong effects with it. I haven't really seen it work very well, but EMDR I have. And EMDR is short for eye movement desensitization and reintegration. And that's a type of therapy, very specific type that's been pioneered in the past, 20 years. And it's a beautiful therapy. So I refer patients to that EMDR therapy. What can I do that could be helpful for that person in that moment who's getting EMDR therapy? Would giving that person cortisol help them? So yeah, actually, truly, studies show that it does in several areas. This is very important. So in this study here, and there needs to be more research on this, but in the study here that you're going to see, this is the study that shows that veterans were given 30 milligrams of hydrocortisone prior to therapy and had a higher rate of success with therapy. They had a better resolution of symptoms. So there are studies out there, just not enough. When we give people hydrocortisone during their therapy sessions, we see a benefit. And it has to do with the way memory is consolidated and your ability to access these memories. It does play a role. There's conflicting research in there, but overall what we see is that there's a benefit. Does that mean the only time you take hydrocortisone right before therapy? And will you find a doctor prescribing it? Not easy. And I personally don't do that yet. I've not needed it yet. I'll be honest with you. What I do in my practice with my patients is that I run the labs and I see what their cortisol is. So let me build you a case real fast here. Patient presents to clinic and they come in, they're having anxiety, depression, they're not feeling good. It's worse around their cycle, but generally all month long. And I run her labs and I find her progesterone levels, during the second half of the cycle are very low. And we know that progesterone plays a big role in anxiety in women because that's the cause of PMS. I'm running on the diagnosis right now that this is a version of PMS. I'm running the diagnosis that this is probably what it is, but I'm not being, single-sided. I need to think about her as a whole human. I'm running other labs. There's other things that cause anxiety. I'm looking at her thyroid, of course. I'm looking at all the other things that can cause that, infections. There's a lot of stuff that creates anxiety in this. I'm not a one-trick pony, and you don't want your doctor to be a one-trick pony. You want your doctor to look at you as a whole person. When a patient comes into my clinic, I just say, I do hormones, so every problem you have is hormonal. That's terrible medicine. I think that's the worst medicine when you go to your doctor and that's all they do. And so everyone that comes in gets that. That's the worst. With that said, sometimes there's specialists you need to see. The knee specialist. Well, if you go to the knee specialist, you got a knee problem, that tracks. But if you go to a hormone doctor and you're going there with anxiety isn't always hormonal. And every doctor should know that. People who walk with a limp, it's not always the knee, and the knee doctor should know that. So they're not going to. What if the limp is because your hip or your ankle or anything else? What else could it be? You know what I mean? Your doctor should always kind of figure you out. So this woman presents to my clinic with anxiety, depression, worse around her cycle. I run the labs, as I mentioned, progesterone low. I also run cortisol. Say, cortisol looks really low. It should be 18 in the morning, 16, 15 in the morning. She's coming in like a 5. That's low, okay? That's my first glimpse there's stress in the equation. Now I should be thinking to myself, did the stress come because she has no progesterone? She's not ovulating, and not ovulating, low levels of progesterone, creating anxiety because of the progesterone pathway to the brain to allopregnanolone, GABA, gamma aminobutyric acid receptors. That whole pathway of anxiety from low progesterone, that's a valid pathway. And that pathway being compromised due to not ovulating would cause stress in a woman, which would over time deplete cortisol because the stress constant without any downtime. Like I mentioned at the very beginning of the episode, with a person who works at a job that's very intense, labor intensive with no downtime, and doesn't get paid well and doesn't get respected, and there's no love in that. Or they're working at home and they're just managing everything. They're doing dishes, they're cleaning, they're preparing the food, they're taking care of the kids, there's no downtime, there's no sharing of the burden. These are real stressors that wear people down. So this woman with low progesterone, anxiety, that's going to wear it down. So I'm watching her cortisol, and I'm going to start treating her progesterone because that's what I feel it might be. That's where my brain is. So I start treating it, and I see how it goes. Now, I want to say, when I first took her into my practice, when I did the first time my intake, I always ask about history of trauma. Rarely does someone give you that history the first time. Trauma is one of those things where we don't always want to share it. And it's one of those things where we get very nervous about sharing it. It's very private. And at first appointment, I don't always get it. Actually, it's rare. Sometimes I do, but not always. So when someone's had PTSD, they come to my clinic and I look at the progesterone, I'm starting to treat that, and I get the progesterone beautiful, cycling beautiful, everything's great, symptoms are a little bit better, the cortisol's still low, and she still feels anxious. I would be a bad doctor if I didn't try and figure that out, right? Yeah. So in that case, that woman, we talk about a history, and now say this is the case I want to present, is that she has PTSD. She experienced a trauma in her 20s, say. Something happened. And because of that event, say she was stressed prior to it, she had the event occur, she has a higher chance of PTSD. She now has a diagnosis of PTSD. Say we initial assessment of PTSD that I see, I do my scorecard, I do my whole intake on PTSD, and I say that's what this looks like. It is. Her cortisol levels, I know for a fact that if I bring her cortisol levels up to an optimal level, that will help her in therapy. That I know. The research stands behind me doing that. And I've done that for years now, and that works well. I've observed it. I refer patients out to therapy. They go into therapy and they take their cortisol in the morning. They match, they get their bodies to go to a normal rhythm of cortisol. Their adrenal levels are optimal. They're being treated well. And that's there. And over time, as I run the labs, as they resolve their PTSD, they need less and less and less hydrocortisone to the point where we don't need it anymore because we have resolution of symptoms. Therapy is complete. So we use hydrocortisone in those cases for those patients because it helps get them through that. The final component of this, I would say, is this, and I want to put the third part in here. I'm trying to not stack too much into this episode, but when someone has PTSD, inflammation is going to be high. Inflammation's high with PTSD. One of the reasons, low cortisol. People with PTSD tend to have low levels of cortisol because they're always under stress. That low level of cortisol, inflammation, of course, but their immune system, it's not going to be healthy. They're going to be more pro-inflammatory because they don't have the natural anti-inflammatory. So it has higher levels of inflammation. They don't respond to infections the way they should. Bacterial, viral, anything opportunistic, the body's not going to do well with. Fungal, all that. They don't respond very well. The person who presents to clinic with PTSD, I need to really think about their adrenals, not just to help them through therapy, but also to help stabilize them and monitor and maintain their health with their immune system as well. Not everyone that comes into my office lets me screen them for PTSD right away. And sometimes when I screen for PTSD, they don't want to go to therapy. It's fair. It's valid. You know when you're ready. I think I help by being in the room, but it's my job also as a doctor to make sure I keep them healthy through this window of time. So by normalizing their cortisol during this period while they have PTSD, that helps to stabilize their immune system. It helps them access the memory more appropriately in a clinical setting with their therapist. And it plays a role with their wellness long term. And the beautiful part about this therapy is I taper them back off of it over time. Some doctors will say what I just said was heretical. They just will. And that's fine with them. That's their role. That's what they do. But those are the doctors that have not gotten you out of anything, have they? Those are the doctors who really haven't brought anything to the table. They're just going to bash things. The other thing about those doctors, they haven't read any of the research that I'm showing you here in this episode. So before we disparage these concepts, let's look at them. Let's think about them together in a positive light. Can these be helpful? Can this benefit a person? What could go wrong? Running the labs prevent us from doing anything wrong with our patients always. The doses of cortisol that I would use in these women, these hydrocortisone in these women and men with PTSD when we treat them, are monitored, and we never let that get super physiological. We always maintain them in a tight range because that's what works. If I let it get super physiological and I kept it up there, of course I'm going to have an impact on their insulin. Of course that's going to cause weight gain. But if I normalize it, will it? Nope. Doesn't. So if I keep the cortisol in that tight range and I take good care of them, I'm mitigating the risks. I'm preserving their health. I'm making it safe for them to get into therapy, not feeling forced into it, not feeling defeated, not feeling broken. I'm trying to help them make that next step into the next layer of their recovery. I've been treating patients with PTSD forever. I don't directly treat PTSD because that's not the type of doctor I am. I always refer out. But I will say that this population inspires me to be the best person I can be in every moment and to be the best physician I can be because I've seen the before and after with them, and it's beautiful. Imagine not having intrusive thoughts. Imagine living a whole life. Imagine not living in fear. And I've seen it. So to the degree that this video helps you, please like, share, and subscribe. It's almost like it's become my call at the end to talk about how Justin and I love your comments. But I'll be honest with you, we do. I don't always get to them as quickly as I should sometimes. I want you to know that's not because I'm not reading them. I'm totally reading them. But some of your comments deserve so much information, deserve so much brain power. But what you write matters to us, and it helps us drive the podcast where it goes. This whole trauma series we just did, we're about to finish with one more episode after this, has been due to your input, your comments and your input. And it's helped us create content that's beneficial to you. And then when you give us comments telling us, hey, this didn't make sense, or that makes sense, or this is helpful, that's not helpful, we use that material. Our goal, Justin and I, we share this goal deeply. We're both dedicated to this. I know I'm the face here, but Justin's the person that makes this work. He can take what we're saying and make it where it's understandable and communicated clearly. This is an important relationship he and I have. We both are incredibly dedicated to this material. We both feel very strongly about it. And we want to do the best we possibly can. So your feedback is welcome and encouraged. I know that I have Justin and I have developed a following we love that following we've developed with you. We love the people that we're drawing to this podcast, and the material that we're discussing with you means a lot to us. I know it means a lot to you. I want you to feel like we are here with you and we have that close relationship. So thank you so much for tuning in, and I will see you at the next episode.